Hello guys, how are you? I hope so that you will be fine and enjoying good till today. I have selected a topic on tonsillitis. So let us discuss what is tonsillitis. So as you know that tonsillitis is inflammation of the tonsils. It's usually caused by viral infection or less commonly a bacterial infection. Tonsillitis is a common condition in children, teenagers and young adults. The symptoms of tonsillitis include a sore throat and pain and swelling, earache, high fever over 38 degrees or 100.4 Fahrenheit, coughing and headache. Symptoms usually pass within 3 to 4 days. Contact your GP or if your symptoms are arisen and symptoms last longer than 4 days and do not show any signs of improvement, and you must consult your GP. If the symptoms are severe, for example, if you are unable to eat or drink due to the pain or you have difficulty in breathing, so you must consult your GP. If necessary, your GP will examine your throat and ask you some questions about your symptoms. If needed, a throat swab can be taken to confirm the diagnosis. The results usually take a few days to return. If your tonsillitis is caused by bacterial infection, they may prescribe antibiotics. Typical signs of bacterial infection include white pus-filled spots on the tonsils, no cough or swollen or tender lymph glands. If you develop severe tonsillitis as a teenager or adult, your GP may recommend a blood test for glandular fever. The tonsils are two small glands that sits on either side of the throat. In young children, they help to fight germs and act as a barrier against infection. When the tonsils become infected, they isolate the infection and stop it spreading further into the body and make a barrier or wall off the infection. As a child's immune system develops and gets stronger, the tonsils becomes less important and usually shrink. In most people, the body is able to fight infection without the tonsils. Removal of the tonsil is usually only recommended if they are causing problems such as severe or repeated episodes of tonsillitis. What causes tonsillitis? Most cases of tonsillitis are caused by viral infections such as the viruses that cause the common cold or flu viruses and influenza viruses. Some cases can also be caused by bacterial infections, typically a strain of bacteria called as group A streptococcus bacteria. These types of infections spread easily, so it's important to try to avoid passing the infection on to others by staying away from public places such as work, school or nursery until your GP says it's safe to return, usually after the symptoms have passed. Coughing and sneezing into a tissue and disposing of the tissue, washing hands before eating, after going to the toilet, and if possible after coughing and sneezing. Then treating of tonsillitis, there is no specific treatment for tonsillitis, but you may be able to reduce the symptoms by taking paracetamol or ibuprofen to help relieve pain, drinking plenty of fluids, getting plenty of rest. If test results show that your tonsillitis is caused by bacterial infection, a short course of oral antibiotics may be prescribed. If oral antibiotics are not effective at treating bacterial tonsillitis, intravenous antibiotics given directly into a vein may be needed in the hospital. What is chronic tonsillitis? In most cases, tonsillitis gets better within a week. However, a small number of children and adults have tonsillitis for longer or it keeps returning. This is known as chronic tonsillitis and surgical treatment may be needed. Surgery to remove the tonsils. A tonsillectomy is usually only recommended if you have had several severe episodes of tonsillitis over a long period of time. Repeated episodes are disrupting your normal activities, so then it may be recommended. Complications of the tonsillitis are rare and usually only occur if it is caused by a bacterial infection. They are usually the result of the infection spreading to the another part of the body. Possible complications of tonsillitis include a middle ear infection, which is otitis media, where fluid between the eardrum and the inner ear becomes infected by bacteria. Then quinsy, which is peritonsillar abscess, an abscess collection of pus that develops between one of the tonsils and the wall of the throat. Then obstructive sleep apnea, OSA, where the walls of the throat relax during sleep, which causes the breathing difficulties and poor sleep. Other complications of tonsillitis are very rare and usually occur only if any underlying bacterial infection is left untreated. They include a scarlet fever, a condition that causes a distinctive pink-red skin rash, or rheumatic fever. This causes widespread inflammation throughout the body, leading to symptoms such as joint pain, rashes and jerky body movement, chorea, etc. Endocarditis as well. Then glomerulonephritis, an infection, swelling of the filters in the kidneys that can cause vomiting and loss of appetite. The main symptoms of tonsillitis is the sore throat. Your tonsils will be red and swollen and your throat may be very painful, making swelling difficult. In some cases, the tonsils are coated or have white pus-filled spots on them. Other common symptoms of tonsillitis include high fever, 38 degrees centigrade, and coughing, headache, earache, feeling sick, feeling tired, fatigueness, swollen lymph, painful lymph glands in your neck, loss of voice or changes to your voice. The symptoms of tonsillitis usually get better after 3 to 4 days. If you have tonsillitis that is caused by viral infections such as the common cold or flu, your symptoms may be milder. If your tonsillitis is caused by bacterial infections such as streptococcal infection, your symptoms will usually be more severe and you may have bad breath. It is difficult to tell just by looking at the person's throat whether they have tonsillitis as a result of virus or a bacterial infection. Tests are needed to confirm this. Antibiotics may be recommended if test shows that your tonsillitis is caused by bacterial infection. Antibiotics are used to treat or prevent some types of bacterial infection. They kill bacteria or prevent them from reproducing and spreading. Antibiotics are not effective against viral infections. This includes the common cold, flu, and most coughs and sore throats. Antibiotics are not routinely prescribed for mild bacterial infection. This is because the immune system can usually clear these on its own. Antibiotics may be used to treat bacterial infections that are unlikely to clear up without antibiotics, could infect others unless treated, and could take long to clear without treatment, carry a risk of more serious complications. So antibiotic to prevent the infections. Sometimes antibiotics are given as a precaution to prevent an infection. This is known as antibiotic prophylaxis. Antibiotic prophylaxis is normally recommended if you are having a surgery in a certain area. This is because there could be a higher risk of infection. Your surgical team will be able to tell you if you need antibiotic prophylaxis. Antibiotic may be recommended for people who are more vulnerable to infections. These include people who are over aged 75 years and babies less than 72 hours old within confirmed bacterial infection, and babies with a high risk of developing bacterial infections, people with heart failure, or people who have taken to insulin to control their diabetes, people with weakened immune system. Antibiotic prophylaxis may also recommend for a wound that has a high chance of becoming infected. This could be animal or human bite, for example, a wound that has come into contact with the soil or feces. Antibiotic prophylaxis may also be recommended for a recurring infection like cellulitis, urinary tract infection, genital herpes, and rheumatic fever. Types of antibiotics. There are many types of antibiotic. Most can be put into 6 different groups. Number 1 is penicillins. These are widely used to treat a variety of infections including the skin infection, chest infection, tonsillitis infection, and the urinary tract infections. Then are cephalosporins. These can be used to treat a wide range of infections. Some also are effective for treating more serious infections like septicemia and meningitis. And then is aminoglycoside. These are used in hospital to treat serious illnesses like septicemia. This is because they can cause serious side effects like hearing loss and kidney damage. And aminoglycosides are usually given by injection. They may also be given as a drops for some ear or eye infections. Then are tetracyclines. These can be used to treat a wide range of infections. They are commonly used to treat moderate to severe acne and rosacea. Then is macrolide antibiotic. These can be particularly useful for treating lungs and chest infections. Macrolide are used as an alternative for people with penicillin allergy. They can also be used to treat penicillin resistant strains of bacteria. Then is fluoroquinolones. These are broad spectrum antibiotics that can be used to treat a wide range of infections. So your GP or pharmacist will tell you how to take your antibiotic. It will come labeled with dose you should take and other relevant information. You should follow the directions on the label and read the patient information leaflet that comes with your medicine too. If you have any questions about taking an antibiotic, ask your pharmacist for advice. Antibiotics can be given in different ways including oral tablet, capsules or liquids that treat most mild to moderate infections, topical creams, lotions, sprays or drops that treat skin infections, and injections given directly into the blood or muscle for more serious infections by the intravenous route or intramuscular route. Missing a dose of antibiotic. If you forgot to take a dose of your antibiotic, take that dose as soon as possible. You remember, you should then continue to take your course of antibiotic as normal. If it's almost time for the next dose, skip the missed dose and continue your regular dosing schedule. Don't take a double dose to make up for a missed one. There's an increased risk of side effects if you take two doses closer together than recommended. Accidentally taking an extra dose. If you accidentally take one extra dose of antibiotic, it's unlikely to cause serious harm. However, it will increase your chances of side effects like pain in your stomach, diarrhea, feeling, or being sick. Speak to your pharmacist or GP if you accidentally take more than one extra dose of your antibiotic. Experience severe side effects after taking an extra dose. Now we would come to antibiotics resistance. Antibiotics are no longer routinely used to treat infections because many infections are caused by viruses, so antibiotics are not effective. Antibiotics are often unlikely to speed up the healing process. Antibiotics can cause side effects. The overuse of antibiotics in recent years also means they are becoming less effective. This has led to the emergence of superbugs. These are strains of bacteria that have developed resistance to many different antibiotics. Superbugs include methicillin-resistant Staphylococcus aureus (MRSA), Clostridium difficile, the bacteria that cause multi-drug-resistant tuberculosis (MDR), TB, and carbapenemase-producing Enterobacteriaceae (CPE). These types of infections can be serious and challenging to treat. The worry is that new strains of bacteria will develop that antibiotic would not be able to treat. Side effects and interactions of antibiotic. The most common side effects of antibiotic affect the digestive system. Symptoms may include vomiting, nausea, diarrhea, bloating, indigestion, abdominal pain, loss of appetite, and these side effects are usually mild and should pass on once you finish your course of treatment. If you experience any other side effects, contact your GP or the doctor in charge of your care for advice. Antibiotic allergic reactions. Some people have allergic reactions to antibiotics, especially penicillins and cephalosporins. In most cases, the allergic reaction is mild to moderate and can cause a raised itchy skin rash, urticaria or hives, coughing, wheezing, tightness of the throat, which can cause breathing difficulties. Mild to moderate allergic reactions can usually be treated by taking antihistamines. In rare cases, an antibiotic can cause anaphylaxis. This is a severe and potentially life-threatening allergic reaction. Anaphylaxis is a medical emergency and prompt treatment should be given. Speak to your GP if you are concerned about your symptoms do not respond to treatment, and or if someone else has taken antibiotic and who has had a rapid heartbeat and difficulty in breathing caused by swelling and tightening of the neck, sudden intense feeling of apprehension and fear, a sharp and sudden drop in the blood pressure causing and lightheadedness and confusion, loss of consciousness. Then there may be interaction of antibiotic with substances and other medicines. Alcohol. You should not drink alcohol while taking the antibiotics, especially metronidazole or tinidazole. You should not drink alcohol for 48 hours after stopping your antibiotics. This combination can cause very unpleasant side effects like feeling and being sick, stomach pain, hot flushes, headaches. Then combined oral contraceptives. Some antibiotics can reduce the effectiveness of combined oral contraceptive pills. This includes the antibiotic rifampicin and rifabutins. If you are prescribed these antibiotics, you may need to use additional contraception like condoms. Speak to your GP, nurse, or pharmacist for advice. Antibiotics can sometimes interact with other medicines or substances. This means it will have an effect that is different from that you expected. If you want to check that your medicines are safe to take with your antibiotic, ask your GP and local pharmacist. What are the effects of tetracycline? Tetracycline is usually recommended unless absolutely necessary. If you have bad kidney disease, except doxycycline, which can be used. Or if you have a liver disease, or you have a lupus, or you are under the age of 12, or you are pregnant, or you are breastfeeding, tetracycline can make your skin sensitive to sunlight, photophobia, and artificial sources of light like sun lamps and sunbeds. This means you should avoid prolonged exposure to bright light while taking these drugs. Aminoglycosides are normally only used in hospital to treat life-threatening conditions like septicemia. This is because they can cause kidney damage in people with pre-existing kidney disease. They are only used during pregnancy if your doctor believes they are essential. Then cephalosporins. Check with your doctor, midwife or pharmacist before taking cephalosporins if you are pregnant, if you are breastfeeding, or if you have any acute porphyria. If you have had an allergic reaction to penicillin, you may also be allergic to cephalosporins. Cephalosporins may not be suitable if you have kidney disease. If you need this antibiotic and have kidney disease, you will probably be given any low dose. And do not take a penicillin-based antibiotic if you have had an allergic reaction to them in the past. People who are allergic to one type of penicillin will be allergic to all of them. People with these allergies are at a higher risk of developing serious allergic reactions to penicillin, and this includes people with asthma, eczema, hay fever. Penicillins may also need to be used at lower doses and with extra caution if you have severe kidney disease or liver disease. Most penicillins can be used during pregnancy and breastfeeding in the usual doses. Tell your healthcare professional if you are pregnant or breastfeeding. They will be able to prescribe the most suitable antibiotic for you. So this was all about the tonsillitis. So I hope so that this topic would be more informative for you, and if you have liked this video, then kindly share this video with other individuals as well, and subscribe to my channel. Thank you for listening this video. Have a wonderful nice day.